Welcome to today's episode on plants that can kill you. In this specific video, we are going to be diving down the rabbit hole on the wolfsbane flower. Other common names for this flower include aconite and monkshood. It's highly poisonous. Their roots and tubers contain the highest concentration of the poison aconitine, although all parts of the plants are toxic. Just a mere 2 milligrams of consumption is enough to cause respiratory paralysis or heart failure. Symptoms that may appear almost immediately include stomach pain, vomiting, nausea, burning sensation of the mouth and tongue, difficulty breathing, and irregular heartbeat. Oddly enough, wolfsbane has been used in Ayurvedic and Chinese traditional medicine as a sedative, diuretic to reduce inflammation, lower fevers, and has been used in aids for colds, pneumonia, and asthma. However, it is really difficult to control the dose, which leads to toxicity. The molecular structure of wolfsbane is classified as an acetyl-benzyl aconine, as well as a nor-diterpenoid. The alkaloid chemical aconitine is what's responsible for the plant's high toxicity. Aconitine can easily form salts and ions and is also polar and lipophilic, which allows the molecule to bypass the blood-brain barrier. This is what makes aconitine a potent neurotoxin. The name wolfsbane was derived from the 18th century, where a common practice in Europe was to coat raw meat with the plant's poison or the aconitine to bait and kill wolves and panthers. Another common practice was to coat arrows, spears, and javelins in wolfsbane for hunting. In many ancient cultures, the plant's purpose was solely for poison, whether poisoning animals or poisoning people. The first recorded human trial conducted was in 1524, where Pope Clementine VII was afraid of being assassinated, so he had his physician at the time create an antidote for the plant. He administered the plant to two prisoners, one with the experimental antidote and one without. The prisoner with the experimental antidote survived and was treated afterward, and the other without the antidote died. Ironically, the Pope would later die not from assassination, but from accidentally poisoning himself with a toxic mushroom. Aconitine is biosynthesized from the wolfsbane through the terpenoid biosynthesis pathway. Only a few alkaloids within the aconitine family have ever been synthesized within a lab. The challenge that chemists face when trying to synthesize the flower is the interlocking hexacyclic ring system found within the aconitine. Aconitine is a highly toxic alkaloid. The cardiotoxicity and neurotoxicity from the aconitine and other related alkaloids is mainly caused by their activity on the voltage-dependent sodium channels. They are considered a voltage gate sodium channel activator. This is because they excite membranes such as neurons, the cardiac conducting system, and the muscles, which causes persistent sodium influx and prevents adequate repolarization. If left untreated, this will paralyze the nerves, lower the blood pressure, and will ultimately lead to the heart stopping. In the heart, the excess sodium influx activates calcium exchange, which can cause intracellular hypocalcemia, which will lead to irregular heart contractions, dysrhythmias, and/or seizures. This is why a victim of aconite poisoning is susceptible to heart failure. Just as it's referred to in the name, the flower is commonly associated with mythical creatures like werewolves. In Harry Potter, Professor Lumen is given a wolfsbane potion by Professor Snape in order to control his involuntary transformations. Another fun fact about the flower is in 2021, the president of Kyrgyzstan promoted the aconite root as a treatment for COVID-19. Consequently, the 4 people who listened and used this method of treatment ended up being admitted to the hospital after suffering from aconite poisoning. Although there is no cure for aconite poisoning, there are treatments that a patient can undergo once hospitalized. The treatment, however, is mainly supportive. Moreover, a standard treatment will include close monitoring of a patient's vitals, a gastrointestinal decontamination with activated charcoal, and once that occurs, a patient will be given atropine, which is used for bradycardia. And lastly, if the symptoms are severe, a patient may undergo a cardiopulmonary bypass, which shows favorable results.